which we're doing on Wednesday during the scrub lab. So there's only like 2 testable slides on here that I'm going to cover. The rest you're going to do hands-on, okay? It's going to be, so I'm going to cover these first few slides, and then you guys are going to look over the slides prior to that lab on Wednesday, because we're going to actually do those. But we have scrub techs who are going to actually help you through those procedures, and they're going to show you it first. We're going to make you wash your hands better than you've ever washed them, and then scrub up in an actual surgical go down, so you don't look stupid the first time you do it. And I haven't done it in years, and I'm gonna look stupid the next time I do it. It's something that obviously you got to practice to be good at. But we're going to talk about, we're just going to talk about the common infections we might see with surgical, if we don't use the appropriate surgical technique, or depending on the procedure we do. So the objectives are really covering everything we're going to do at that lab, which we'll do on Wednesday, and we'll do it hands-on with demonstrations first and show you what right looks like. And then you'll have the scrub techs and the guys who run the courses there, so they're a lot better at it than I am or we are. So they'll show you what actual right looks like versus slides. It is nice to go over it first. Well, what we're going to cover today is the different types of bacteria or infections we commonly see at the surgical site, depending on what procedure we're doing. So these are one of the most common hospital-associated infections. We see it all the time. I see it just about every day in the ER from some post-op complication. And a lot of it is really because we have bacteria that commonly live on our skin and in our organs in our body that can infect these areas, which is why we try to cover with prophylactic antibiotics. Typically, like we give, 2 grams of Ancef to just about everybody that walks in the door that we suspect may need an operation, or if it's a significant infection. So we do use evidence-based practices, and we really look at 3 factors when we are doing this for where that infection is coming from. So we want to look at the infecting organism, so we need to think it's probably going to be bacterial in a surgical patient. We've obviously sterilized that area, but it's very hard to kill all of the bacteria of the common flora that live on us. So it's never 100%. So even when we clean that area, we're using betadine, we're trying to avoid all these different things. Has anybody ever had to try to kill or do like one of those MRSA protocols to get rid of it? It's like months of swabbing your nose, putting mupirocin in there, an antibacterial ointment. You're supposed to take, not betadine, chlorhexidine bath multiple times or throughout the period to kill all of that MRSA that lives in you. It's basically impossible, is what I'm getting at, to kill all of those bugs that live on you. So first we want to think about what organisms it is. So most commonly staph, which lives on our skin, and we'll talk about that in a sec. Then we want to look at the environment on which it takes place. So it's a surgical site infection. So likely it's something coming from some sort of skin flora, but what was the underlying surgery? Did we violate any of those organs? Do we have any sort of like succus spill from some sort of bowel that we perforated or that we're operating on? Did it get into the sterile field or environment? So that's going to increase our risk of infection. So we always want to look at where that operation was, and then we want to look at what sort of immunocompromising conditions or what sort of host defense mechanisms they have. Obviously, we get more concerned if they're diabetic, if they're like immunocompromised from HIV or any other immunocompromising condition we have. So we need to consider that as well when we're looking at what this infectious process is following these infections. So here's the important part you need to understand and remember is the different organisms that can possibly infect these patients. And we talk about a lot of times the, whether it's like Staph aureus, which it typically is, there's typically Staph aureus is most common. But we like to break it down whether it's like gram-positive cocci, because that's what our antibiotics are going to be attacking or hopefully fixing. And then whether it's like gram-negative organisms, whether it's anaerobes. So that's kind of how we break it down. But obviously the most frequent bacteria we see is going to be our Staph aureus, strep, and then we have our gram-negatives, gram-negative bacilli, E. coli being the most common, followed by Pseudomonas. So does everybody understand, like Staph epidermidis is a common skin flora that lives on our skin, and it can also cause an infection, but it's less common for it to cause a virulent infection. So a lot of times when we run a sample or culture on these patients, we'll get Staph epidermidis in there, and it may or may not be the culprit for what's causing this infection. But most commons are Staph aureus and E. coli are going to be our big ones. Now we want to think, like, if we're worried about enterococcal species, that's going to be our fecalis and Faecium are going to be our other most common ones that we see, with the Faecium being vanc resistant, so that's a big consideration. But most commonly what you'll see in the, from a surgical site infection, the patient, they had, some sort of abdominal procedure, the site was eventually closed, they probably spent time in the hospital, and then what you need to evaluate is, okay, which, probably going to be Staph aureus, so we need to make sure we're covering for like our gram-positive, cocci. And then we got to think about, okay, but what happened during the surgery? So they, they were obviously, if they were in the abdomen and they had some sort of succus spill from one of their intestines in there, then we need to think about what our most common intestinal bugs are, which is usually E. coli, right, that lives in there. And that's why we commonly see it for urinary tract infections as well, typically, because you have, obviously, your rectum is right next to that area, and wiping, that's why I see more commonly in females, just because of the way we're designed, and we see those bugs kind of infect there, which UTI is most commonly E. coli, because that comes from the GI tract. So the two important ones are Staph aureus and are covering for our E. coli when we're treating these infections, but we do need to get a good history, like what type of procedure they had. Did they have any sort of complications? If you can look at the opera report, great, and they'll tell you in that. The patient typically won't know, and they don't tell the patient, but it is something you need to consider when you're treating these patients or when you're worried about any sort of surgical site infection. That's really it for this block, or for this lecture. Those are really the two slides you guys need to pay attention to. Most importantly, this one, okay? And then please review it before the lab, but we're going to show you at the lab how to, what right looks like, and then make you guys do it while you're there, okay? All right, what questions y'all got? Nothing? You guys hungry? How did peds go? Everybody good?